Welcome to Asthma Home Care Management Plan and Education. My name is Lynn. I'll be presenting your home asthma education. All right, so we're just going to go over some objectives to be expected out of the presentation. It's to understand what asthma is, a brief overview, nothing too extreme to go into the anatomy or anything. We'll be able to identify the signs and symptoms of an asthma attack. We'll go over some medication. It's a very broad, like a review of a medication, because some people take different medications. Some people use different apparatuses, different devices when administering their medications. So we're going to go over the basic ones, which is typically an MDI or DPI. We'll demonstrate proper medication techniques. We'll be able to distinguish between improving or worsening symptoms, and we'll be able to discuss the outcomes and benefits of following your home care plan. And towards the end, I will answer any questions or comments and concerns that you may have. All right, so we'll start with what is asthma. Asthma is a chronic disease that affects the airways in the lungs. During the asthma attack, airways become inflamed, making it harder to breathe. Asthma attacks can be mild, moderate, or serious, and even life-threatening. I took this image off the website. It pretty much shows what is happening to your lungs and to your little airways in your lungs. So your lungs are pretty much made up of these small little tubes, and when you start having an asthma attack, they become inflamed, which is more of like a swelling, and then after they become swollen, they become very, very constricted. And when this happens, on a majority of the time, you start producing mucus or phlegm. This obstructs your airways, making it very, very hard to breathe, and that's where your asthma attack comes into play. So I thought that you might want to see like a little, image of it. I'm very visual. All right, so we're going to continue here. What is asthma? Continued. Asthma is a reactive and obstructive airway disease that is very manageable. Like I said, your airways become inflamed, so swelling, and then you have the constriction, and then you also have the mucus or phlegm production and buildup, and then that includes your airways, your tiny little airways, for making it a little easier for you to breathe. I went over other things. So another thing that you may want to look out for with having asthma that we're going to be reviewing as well are some triggers. Triggers are things that flare up your asthma attacks. They can range from smoking, they can range from just having simple allergies or having a cold or a flu. Asthma does affect people of all ages. It does not discriminate. And a little quote I took from online is, the cause of asthma, unfortunately, is not known, and there is currently no cure. However, there are things you can do so that you can live a very symptom-free life. And we'll be going over some of those. So next we'll be going over the signs and symptoms of an asthma attack. Your airways constrict and they become inflamed, and making it very difficult to take deep breaths. When they become this narrowed, that's when you hear the wheezing. That's typically what happens to most asthmatics, is that they start wheezing. It's pretty much everyone's first sign of you're having difficulty breathing, and that's when you start using your drugs. Some people feel a chest tightness. A lot of kids tell me that they feel like there is something sitting on their chest. So that's where we get the term an elephant on your chest. I've actually heard kids say that to me once. It feels like there's an elephant sitting on my chest, and then he was just bobbing and weaving and just having a real bad time breathing. Another thing that we look for in the signs and symptoms of asthma is retractions. I see this typically more in children, but I have seen it in adults. Retractions are pretty much when you take a deep when they take a deep breath, you can actually see the outlines of their ribs. We like to look at those because that typically tells us that they're having to work way harder to breathe. And they're using more muscles to have the ability to breathe. So that will cause us your retractions. So the next one is goldfish breathing. This is kind of an older term. I have not heard this one yet, but I have seen it. Maybe I can play this video. No, I cannot. That's unfortunate. So you can, more than welcome, copy and paste that, look it up, write it down. It's an old TV ad commercial that I typically like to bring into my asthma education. It's of children describing how they feel when they're having an asthma attack, and it's one of the children on the ad say that it feels like they're a fish out of water, and then they feel like they can't breathe, hence the goldfish breathing. I've seen it in adults. Adults do it. Kids definitely do it, and it's just, I thought that was something very interesting when I was going to school. She showed me this video and it kind of just stuck with me, so now I like to use it as well. Diaphoretic. Diaphoretic is just this fancy way of saying becoming sweaty. So when you start becoming sweaty, you're obviously working very hard to breathe. So using all those muscles and everything, you begin to sweat. That's kind of like a moderate symptom of an asthma attack that we kind of look out for or try to prevent. Hyperventilation is pretty much you breathing in and out pretty fast, fast and shallow breaths. Like when you start breathing fast and shallow like that, though, you're getting rid of the CO2 that needs to stay in your body. So when that happens, you're breathing all that CO2 out. I know it just sounds really weird. Let's just say you're breathing really fast. So when you're breathing really fast, you become lightheaded, become dizzy, and you might even faint, which is not good especially if you're having an asthma attack. Hypoxemia is a fancy way of saying that you don't have enough oxygen in your body. If this is a problem, you probably need to go to the emergency room and get some oxygen, unless you do have oxygen tank at home or a concentrator. Then I would most definitely put that nasal cannula on and give yourself some oxygen. Another last thing I like to go over is you become a little lethargic, and you may even become unconscious. This is a severe symptom, I believe, because when you become that tired from having to work so hard to breathe, that you're just showing how tired you are. Inevitably, if you go untreated, or if you're not managing your asthma very well, you'll become unconscious because you will tire out, and that is when you want to go to the hospital. I mean, you don't ever want to get to that point of I'm so tired, I'm just going to see how long I can last. No, that is a huge no. I hope that you would I would hope that you would go to the hospital well before you get to that point. All right, sorry. Let's go to this. As I said, I'm a very visual person, so I just chose this picture because I thought it was neat. You have little signs and symptoms of asthma. You have some coughing. That's the mucus and phlegm producing in your airways. The inhaler, I guess, is when you actually have to use it. It has become difficult to breathe. You're feeling tired, which is becoming lethargic. You're having that chest pain, that chest tightness. Oh, excuse me. You're having wheezing, which is your airways inflamed, and constriction. And you also are having shortness of breath because you can't take that nice deep breath. And of course, you will have sleeping problems because it is uncomfortable not being able to breathe. And being uncomfortable means you can't sleep well. Okay, so next thing we're going to go over are triggers. So triggers are usually allergies, anxiety, exercise-induced, so air pollutants. Air pollutants could be something from you working with paints or solvents or anything like that that is not in the natural air, just like very nasty chemical, or gasoline. People that are smoking, or you smoke, you can pretty much be triggering your own asthma. And sometimes your asthma exacerbations really won't flare up until you have a cold or fever or some sort of infection. I believe it is very important to know your triggers to avoid any future asthma exacerbations or flare-ups. You can go to your doctor and you can request for an allergy test, which will kind of help you determine what you're allergic to avoid certain things. It's always good to know. It's going to help you in the long run. I don't see anything wrong with it, and in fact, I see more of a benefit from it. If you want to learn anything more about triggers, there's this great website called the American Lung Association. Check it out. Okay, medication or broad spectrum. Medications are typically used as MDIs, which is the top image there, or a DPI, which is the bottom image. MDI stands for metered dose inhalers, and DPIs are for dry powder inhalers. The thing I want to go over for the broad spectrum is that a lot of people do use different ones, but these are typically the basic ones that a lot of asthmatics have. So I just took the liberty of going over these, and if you have any questions about anything else, you're more than welcome to ask me. I wanted to go over what a fast-acting drug is and what a maintenance drug is. A rescue drug is typically your albuterol, which is the top one. It comes in a little canister like that, and a little inhaler. And I think a spacer is one of the greatest inventions ever. It is a fast-acting drug to relieve symptoms immediately, and then you use this as necessary every 1 hour, 2 hours, 4 hours, and as needed. Doses 2 puffs, 4 puffs, 8 puffs, and it relieves it immediately. It should relieve it immediately is what I should say. The next one is a maintenance drug. A maintenance drug is typically only used once or twice a day, and it comes in a little disc, or it comes in a little pill thing. Like I said, different devices. This drug usually helps reduce flare-up incidences throughout the day. So this needs to be a little enforced here, is that for a maintenance drug like Advair, you wouldn't typically use this for an asthma attack. What you would use, and what you would most definitely use, is your albuterol. Albuterol is a fast-acting drug. Advair is not. It is a long-term, prolonged thing that is pretty much a preventer. The albuterol actually goes in and relaxes the smooth muscle tissue in your lungs and relieves the symptoms of the chest tightness and the wheezing. I just wanted to put a little emphasis on that. Okay, so we're going to go over how to use these properly. A metered dose inhaler, you shake the MDI, you attach it to the spacer, and I really wish I had this on me. You take a deep breath and you exhale completely. You seal your mouth around the mouthpiece of the spacer, and then you just press that canister, and you breathe slowly but deeply for about 4 to 6 breaths. And after that, you wait 15-30 seconds, and you repeat the process as needed or as ordered. There is a great, well, I tried playing the video earlier, but it wouldn't play, but there is a great video here for you to watch provided by the CDC on how to properly use an MDI. It is a little dry, but is only a minute long, and it teaches you properly how to use an MDI. A dry powdered inhaler is a little difficult. It does take some good coordination. So what you do is you're going to you're going to pretty much get the dose ready. And what it is pretty much you just trigger and you get it ready, and it's ready now. It is a dry powder, so what you're going to do is hopefully not breathe into it. So you're going to take a deep breath in, take a deep breath all the way out slowly, and you're going to get a nice mouth seal, and you're going to inhale fast and deep. And you're going to want to hold it for about maybe 5 to 10 seconds. And usually I only see this done once, but like I said, this could be done twice a day, depending on the medication you're using. And now, to almost, we're going to determine if your symptoms are getting better or worse. Improvements to look for are your wheezing has decreased, meaning your smooth muscle tissue in your lungs have been relaxed and not constricted anymore. The chest tightness that you would have felt is kind of relieving. It's kind of relieving, and you can now take a nice deep breath. You're going to see less retractions. And overall, you will have less asthma exacerbations if you're improving. And you might even be able to cough effectively since you're able to take that nice deep breath. So signs and symptoms of worsening even after medication administration is your wheezing is still present. You're unable to take that deep breath. Your retractions are still present, or they've gotten deeper. You feel lightheaded, and you're lethargic. I don't know, typically most patients have their own personal action plan, home care management plan, but after giving yourself like 2-3 doses of your fast-acting drug, I feel like you should probably go to the hospital, depending on how your action plan is set up, especially if you're becoming lightheaded or lethargic. All right, so nearing the end, I feel like monitoring your asthma is overall very beneficial to all asthmatics. Monitoring your asthma helps you notice the start of an asthma attack early by starting treatment right away, may be able to avoid having a serious asthma attack. I believe that if you follow your home care regimens, you will most definitely have less asthma exacerbations. You'll have less hospital visits, and overall, you will have an increased quality of life, and you'll be able to enjoy more things that you typically like doing without having to deal with an asthma attack. Do you have any questions, comments, or concerns? I'm more than able to answer them. If for you, one probably is, why am I wearing a hat? It is because I work night shift and I just woke up 2 p.m. to do this. And I got off work at 8. And I would like to thank you. Thanks for your time and interest in managing your asthma. Please feel free to contact me if you have any questions or concerns. There is a really fancy phone number I came up with. It's not real, so hopefully you don't call it. And there's an email that is also not real, but I thought you would have enjoyed it. All right.